As the world-leading manufacturer of powered wheelchairs, Permobil offers a range of wheelchairs for children, young people, and adults. Travis will cover independent repositioning, basic adjustments, and alternative drive controls of Permobil wheelchairs. Travis Carlson is an assistive technology professional specializing in seating and positioning. He's worked as a dealer of mobility equipment for 5 years before coming to Permobil. And now we'll turn the time to Travis.
Thank you. It's good to be with you today. Again, I'm Travis, and I've been with Permobil for about 4 months now. I worked for a dealer for about 5 years before coming to Permobil, so I have a little bit of experience with seating and positioning and electronics with power wheelchairs. Just a little background on Permobil, where we came from and who we are. Permobil started by a doctor named Per Uden. He lived in Sweden, and in 1963, one of his patients came to him and asked him to build a wheelchair that would work for her indoors as well as outdoors. And so he went down to the basement of the hospital that he worked in, and with a couple of colleagues, they built the first front-wheel drive power wheelchair. And in 1966, they had these in production. And so I'm going to talk a little bit about different types of power wheelchairs, the different setups that we can have. My Prezi didn't quite work, which is going to be kind of like our PowerPoint presentation for today. So the first part of this, I'm just going to refer to my notes, and the second part will be able to allow you to see what we're doing. So some of the things that we're going to talk about first is who qualifies for power wheelchairs. And so that's going to be anybody that can function the chairs first off in all environments, whether it's at home, in a work setting, going to school, or in the just recreational setting. We've got specific guidelines for these that basically Medicare has come up with, and we've got to make sure that people are safe in the equipment and that they can efficiently use it. And so when you're looking to evaluate somebody for a power wheelchair, you're going to have typically for a high-end chair, an assistive technology professional be involved, as well as a doctor and a physical or occupational therapist. And they will try out different types of equipment and make sure you qualify for the equipment. So some of the reasons that we put people in power wheelchairs, especially we're starting to see a lot more children that are younger and younger, down to 18 months of age, get into powered mobility. And the reasons that we're seeing this is because it helps reduce the risk of learned helplessness. They go from being in a passive environment to being in an active environment that allows them to dictate where they go and what they do. And it helps promote their self-confidence. It helps with the children. It helps with the adults to be able to do what they want when they want. It helps increase their learning and their development. As they're able to navigate, it just opens up their mind to be able to learn more. And it allows for visual development. It's kind of like a baby crawling. It helps with that. And so we're going to talk about a couple of different configurations for the power wheelchairs. At Permobil, we offer a choice for every user. So we have mid-wheel drive chairs, we have front-wheel drive power chairs, and rear-wheel drive power chairs. And so I wish I could have got this to send over, but I couldn't, so we're not going to be able to see exactly all the pictures that we have of these. We're going to start off with a rear-wheel drive power wheelchair, and I was not able to bring one of those with me today, but our model of a rear-wheel drive chair is the C350, and that chair is able to have a power tilt, recline, elevating seat, and power leg rests on it, which we'll talk about the clinical benefits of those in a little bit. But the rear-wheel drive power wheelchairs are fading away more and more with the front-wheel drive and the mid-wheel drive chairs. Some of the perceptions of the rear-wheel drive chairs, and a reason why a lot of people use those, is to achieve higher speeds, and they track really well while doing that. And that just means when you're driving, the chair doesn't sway back and forth. They have really good suspension for outdoor use. when you're climbing obstacles, they do really well on obstacles. The downfall to that is you have to make sure that if you're going through a doorway threshold, you can't hit it on an angle. You have to go straight onto that obstacle to be able to go over it correct. One of the negatives to it, and why a lot of people have gone away from the rear-wheel drive chairs, is they have a large turning radius. It's the largest of all the chairs. And another thing that people are going away from it for is the footplate on the chair. It causes interference with the front casters, and so you're not able to bring the footplate all the way back under the chair at a 90-degree angle. And so if somebody has tight hamstrings and contractures, it's not really easy to accommodate that with the rear-wheel drive. The powered seating is also limited on them because of stability of the chair. If you tilt back and all your weight is over the back of the chair, it can cause the chair to flip. And so we have to limit what the angles are for safety of the user. And so, like I said, the rear-wheel drive chairs, they're not used anymore, or not as much anymore. When doing evaluations, if somebody had been using a rear-wheel drive chair for 20 years, I would never switch them to a front or a mid-wheel drive chair just because it's going to drive somebody insane. They got used to how that drives, and they'll basically hate anything else. So it's always wise to at least trial equipment if you are going to switch a user from the rear-wheel drive to front or a mid-wheel. And so the turning radius on our C350, and that will be with the foot plates down, is 32.9 inches. And so that's a good 8 inches more than our mid-wheel drive and our front-wheel drive chairs. So the next chair that we'll talk about, and that's one that I have with me today, is a mid-wheel drive chair. And the mid-wheel drive chairs are designed for indoor mobility. They're very intuitive when driving. The center, or the drive wheel is right under the center of the user, and so it makes it a lot easier to be able to navigate and maneuver the chair through a home or a tight setting. The other nice thing about the mid-wheel drive chairs is you have 6 wheels on the ground at all times. And so when you're going up or down ramps, you have the stability of those front casters to be able to keep you from rocking forward, and the rear casters from keeping you from rocking backwards. We actually offer 2 different size of casters on our chairs. These are the 6-inch casters, which are a lot better for an indoor setting. You have a tighter turning radius, and you're able to bring the foot plate right here to a 90-degree position and to be able to clear the casters with that. So the 8-inch casters that we have are much better for an outdoor setting. They allow you to climb an inch bigger of an obstacle, so if you have a small curb cut out or rough terrain to go through, it allows you to get through that much easier. Just as an example, just recently there's a patient up in Idaho that works out on his farm, and he wanted to be in a mid-wheel drive chair, which for his type of environment is not something that we would typically use. And so he tried a competitor chair with the 6-inch caster and then our chair with the 8-inch caster, and he was able to make it throughout, all parts of his farm actually with the 8-inch casters. The nice part about those is they make it so the chair doesn't high center as easily, which is something that can commonly happen with the mid-wheel drive chair. And so actually, the 6-inch casters to a lot of people from us might be kind of new, and so this is possibly the first time you'll see it. And so before this, we had the 8-inch casters, which you could only bring your legs, well, you couldn't quite bring them back to 90 degrees. It'd be roughly probably 80 degrees that you could bring your legs. And so this just allows a user to have a tighter radius inside a tight bathroom, and just makes it easier for people that don't have the cognitive ability to have the leg rest out far enough to clear the casters. The other nice thing about the mid-wheel drive chair is the stability for powered seating. It allows you to have a full 50 degrees of tilt and full recline on the chair. And the center of gravity actually shifts to the middle of the chair, so you won't tip the chair over if you're performing those weight shifts that everybody should be using if they're in these chairs. So one, just a little fact about our chairs is we actually have on our mid-wheel drive chair, we have what's called a linked suspension. And what that means is if you take this drive wheel off down below, you'll see where the suspension is actually linked to the motors. And so if somebody goes over an obstacle with either the front or the rear casters, it pushes that drive wheel down, which allows you to have a lot more traction. And it actually prevents that high centering that I was talking about. We have 3 inches, or we can go over a 3-inch obstacle with the front casters and a 2-inch obstacle in the rear. And I believe that's actually one of the highest obstacles that anybody can reverse over with a power chair is with this M300. And so the turning radius, and this is without the foot plates, is 20 inches with the mid-wheel drive chair. With the foot plates on, I don't have the newest number with our 6-inch casters, but with our 8-inch casters, it was 25 inches. And so we can probably knock off 2 inches is what I imagine with the 6-inch casters. So the next chair that we'll talk about is a front-wheel drive chair. And actually this, the standing power chair, I'm going to pull this forward just for a second here to show a front-wheel drive configuration. So the drive wheel is up at the front of the chair, just like it would sound. And the nice part about this is they are incredible in the outdoor environment. Just recently I was at a school with a therapist, and most people are 100% pro mid-wheel drive chairs. And I think it had snowed about 4 inches, and so we were out in the parking lot, and he didn't believe that a front-wheel drive chair would do better than a mid-wheel drive chair. And so we put it to the test, and mid-wheel drive chair got stuck pretty dang quick. And the front-wheel drive chair, we were going up and down the ramp and all over. It's kind of like a front-wheel drive chair on a car. It allows you to pull the rear casters through everything. Where the mid-wheel drive chairs, if you're in gravel or rough terrain, you're pushing casters, and it just causes a lot of strain, I guess, on the motors and causes people to get stuck a lot more often. And so this is a front-wheel drive configuration. Couple of really nice things about it is it is able to accommodate tight hamstrings. Where the rear-wheel drive, you can't bring those foot plates all the way back to a 90-degree position. You can do that with a front-wheel drive chair. And so that's probably one of the biggest things. It handles well across all terrains. It's actually, driving these, you have to learn to drive these a little bit different than a mid-wheel drive chair. The mid-wheel drive chairs are, like I said, a little bit more intuitive. The front-wheel drive in a tight area, I've actually seen perform better than the mid-wheel drive if people know how to handle that. They have to hug the wall. If they're going to turn into a door on the left side, they hug the wall on the left. And as soon as the drive wheel hits the corner of the doorway, they can flip the back end of the chair around. I actually saw somebody with this chair drive it better through the home. And this is a big chair, better than a mid-wheel drive chair just recently, just because of the way that back end pivots around. I'm going to say that the front-wheel drive chairs have the absolute best climbing abilities out of all the chairs. And that's because the drive wheel is in the front of the chair, and it's a big wheel. It's a 14-inch wheel, and it allows you to go over obstacles and be able to track the chair straighter as you go over those. So there's actually a lot of people with the front-wheel drive chairs perceive that they have really poor tracking abilities and that they sway a lot when you drive them at high speeds. And the motors that we put on these now prevents that. So it's a lot easier to drive in a straight line at 5 or 6.5 miles an hour, whatever your motor package is. The turning radius with the foot plates on this chair is 25 inches. And so it's got a really tight turning radius, actually very similar to the mid-wheel drive chair. It just drives differently. And so I just wanted to go over a couple of these chairs real quick. I wasn't sure who the audience would be today for this presentation. So I just kind of wanted to make people somewhat familiar with the different types of chairs that there are, and and just to know what I guess what the options are really. A couple of the other things that we're going to be talking about today now are going to be some basic adjustments of the chair. And the reason that I'm wanting to talk about this is because I get calls from the dealers of the assistive technology, from family members and clinicians, just about some very basic things. And so it's just kind of good to go over. And so we're going to start off with just the armrest height adjustment on these chairs. So I've got these a little bit wobbly right now. I loosened them up ahead of time. But on the back of all of our newer seating system, which came out 3 years ago, it's the 3G seating system is what it's called. We've gone to a cantilever arm style. And what that means is there's no bar here to support underneath. We don't need that anymore. Our arms are strong enough for people to put their weight on and perform weight shifts. And with that, we actually send all the chairs out with an Allen wrench in the backrest that will do most of the adjustments on the chair. And so to adjust the height of the armrests, you have 4 bolts, 2 on each side, top and bottom, that you need to loosen up, which I've done ahead of time. I'm pretty sure I got them all. So you have to make sure all 4 of these are loose before you can adjust the height of the armrests. And on top of the armrest, this bracket here, there's a spot that you can put this Allen wrench in, and you turn it clockwise to raise the height of the armrests. And one thing that I would point out is that if you have a client in the chair, make sure their arms are not on the armrests. It makes it a lot harder for you to turn this bolt, and it actually makes it a lot easier if you flip the armrests up out of the way and then turn it. It makes it so much easier to do. And so you can see the height setting that you're at right here with this little screw on the back. It will tell you how many inches you're going up as you turn that. And so once you get that to the setting you need, you can put the arms back down. And you've got these, I don't even know what they're called, little twisty things that you can turn to adjust the angle of the arm pads. So if your arm pad is angled up too high, you can twist these to adjust it down or up. And so the armrests are probably the most common thing that I'm asked to help adjust. And so some other things that we can adjust is we have a lateral pad on each side of the backrest that's built in. And you can adjust that height up or down just by loosening this bolt and then sliding it up or down to the desired position. And then just tighten it back up once you have it where you need it to be. The backrests on our Corpus 3G seating system, they have 5 inches of adjustability, so you can do it inch by inch, which is very nice for a user that might have a 22-inch shoulder height. There's 2 bolts inside the backrest that you take off, and this is probably where you're going to have your dealer get involved to adjust. But you can adjust that back height to where it's meeting their shoulders. So that was just something basic that I actually got a call yesterday on, and so I wanted to just kind of point that out to those watching this. If you have a family member or a patient that needs a quick adjustment, it's important to have the armrest set at the proper height to keep somebody in the proper seating position. And so that was something just basic I wanted to go over really quick. This next part we should have the Prezi set up for it. Maybe. There we go. Is that coming up? Perfect. It's a little bit off. There we go. Okay. So we're going to talk about powered seating and why you would need to use the power seating functions and who's going to qualify for them. The first function that we're going to talk about is actually the power tilt. And I better tighten this armrest up a little bit before doing this. And so the easiest way I can explain a power tilt is kind of like sitting in a kitchen chair and tipping the chair back and ticking off your mom or grandma is who it was in my house. So the power tilt allows you to go back 50 degrees, and this is going to help with pressure relief. So this is going to help reduce the risk of pressure sores by allowing the blood to circulate through the buttocks. If somebody's sitting for a long time, they're at a very high risk of this. And so it also helps with postural stability. By people that get weak throughout the day, if you have an individual with ALS or MS, as the day goes on, they fatigue. And this allows them to tilt back just to take some of that pressure off their trunk and the strain off their trunk. It helps with increased sitting tolerance that goes along with that by tilting back throughout the day multiple times just to relieve that. It actually, sorry, I can't see that. So, yeah, it's a position of rest. So on the Prezi, you see that it reduces fatigue. With the tilt, the back angle is set at whatever angle the clinician and patient and everybody decides it should be at. So you're stuck in that position all day. It's really good for the pressure relief, but the hard part is if you look at us when we sit down in a chair, we often recline or we put ourselves out of position to be able to open up our hip and back angles. And so with just a tilt only, you're stuck there. So our chairs have 175 degrees of recline. And so that's where you can start to open up your hip to back angles and independently position yourself if you have the power recline. If you don't ask for the power recline feature in a chair, if it's an insurance that dictates that, you're going to have a caregiver help the end user to be able to recline the chair manually, and you can't change that position often. So the reasons for the power recline is going to be similar to the tilt with pressure distribution. It's going to reduce the risk of pressure sores. You'll see clinicians that are all about a power tilt or a power recline. The hard part, if you just do a power recline on the chair, is when you recline the backrest and bring it back up, it can put you out of your position. So if you have an individual who's possibly a high-level spinal cord injury, they're not going to be able to slide their body back in the chair, and so they might sit in a posterior pelvic tilt because of that. It helps improve your sitting tolerance. I don't know if you guys have ever sat on an airplane. The first thing I think most people do as soon as they get to the proper altitude when the pilot allows them is recline their chairs. Not many of us want to sit at a 90-degree angle all day. And so the recline allows people to open up that angle. It also helps reduce fatigue just by being able to lay down. It's kind of a place that people can rest. So actually, shearing is something important to talk about with the backrests. They haven't always had, well, in recent years they have, but backrests haven't always had shear reduction when you recline. And so what this allows is the backrest to kind of slide as the chair reclines, and that keeps from tearing the skin and the deep tissues, and it helps keep somebody in alignment in the chair as well as keep the headrest in position for their head to support somebody when they recline back. Recline is actually medically justified for bowel and bladder management. If somebody needs to self-cath throughout the day, most people need to sit back a little bit to do that, and this can help with that. If a caregiver is changing somebody and the client is too big to sit in Hoyer transfer back and forth to a changing table throughout the day, and it's causing pain in somebody's back to be lifting all day or multiple times a day, recline can help with that as well, because you can lay the patient out flat and basically have a changing table right there. So actually one thing I want to talk about is the benefit of power tilt and recline at the same time. With pressure mapping, power tilt does a lot for people, and we know that it really helps. But if you add the recline in there, if you do 25 degrees of tilt and then 130 degrees of recline with that, the pressure, it changes significantly, actually. I've seen some studies and some pressure mapping where you do a recline only, tilt only, compared to the tilt and recline. And the tilt and recline is going to work best for somebody who is at a high risk of pressure sores. So I just wanted to kind of bring that one up real quick. So the power leg rest, we have 170 degrees of elevation with those. And so one thing you'll notice with our chairs, actually, this is just a little side note, is we have a very clean design with our actuators. On our power leg system, we don't have motors and a whole bunch of stuff underneath the chair. A lot of people are into the cosmetics of a wheelchair, and the most common thing I heard is they don't want to look handicapped. And that's something that Permobil is really focused on, is trying to make a clean user, or a clean chair for the end user. And so we have a very clean design under here. Our actuators are all hidden underneath the chair, just kind of out of the sight, so people feel like it's more of just a fancy wheelchair. And you'll notice that on the backrest as well, that we don't have bulky boxes back here to hold all the wires and the actuators that recline the chair. So we have a very clean design, and that actually works well in the home if you're trying to maneuver. You don't have a big box in the back of the chair that clips into doorways or walls as you drive through. And so this is the elevating legs that we have here. Go through some of the reasons for that. The biggest reason that people throw elevating legs on a chair is to help with lower extremity edema. The funny part with that is people will want that on a chair without a tilt or recline, and that kind of doesn't really benefit you too much. To help with lower extremity edema, you need to get the feet above the heart. And so if you have the elevating legs with a tilt or recline, you can see how it gets your feet up into a position where it can actually allow the fluids to drain. And so it's pretty much necessary for that, for edema, to have with a tilt or a recline or a tilt and recline system. It can help accommodate contractures in the legs, and actually a lot of people use it for stretching. If somebody needs to stretch out their hamstrings, this can be one way to do that. You can set the parameters with the clinician, how far they can go, and use it to help accommodate that. Actually, with our leg rest, you can adjust each foot plate independently. And so if somebody has a leg length discrepancy, the leg rest will go anywhere from 6 inches on the length down to 17, somewhere in there. I'm maybe a little off with that, but so you can accommodate having one foot plate up shorter than the other foot plate. And so it can help with the discrepancies on there. It can help with circulation as well as with pain management. You'll see a lot of patients with neuropathy that need to be elevating their legs regularly. So I know I already hit on the tilt and recline, why you would use both tilt and recline, but it does give you the maximum pressure relief. Sitting tolerance is huge. If you can spend more time in the chair, you're independent that much longer, rather than transferring to your bed and having to lay down and not be a part of activities with your family, or if you're at work, it can allow you to perform a full day of work. Comfort is another thing that we talk about. I know insurance companies don't like the word comfort with a wheelchair. It's not really a justification. But a tilt and recline system does allow somebody to be more comfortable, to spend more time in the chair. It helps with respiration, being able to open up a little bit. Tone management, being able to change those positions often. We weren't created to sit in one position all day long. We need to be able to move regularly, as well as medical management, which we've talked about. So, before moving on to this next segment of power standing, so this is something that right now we're the only people that are able to do this on a wheelchair. Any of our chairs that have multiple seating functions, like a tilt, recline, power leg rests, we have what's called independent positioning. And for clinicians, this can be really big. When I was on the dealer side, we would get people a tilt and recline system, and we'd tell them to go home and tilt every 15 to 30 minutes for 1 to 3 minutes. That's kind of the standard for performing pressure reliefs. And somebody would come back a while later with pressure sores, and you ask them if they're performing their tilt or their recline, and they tell you they are, and what they show you is that they go back maybe 20 degrees. They don't go back too far. And this is not enough to perform a pressure relief. If anything, it might slide more pressure onto your ITs. And so with the independent positioning, what we can do, and this comes standard on our chairs with this little switch box, is we can, with the clinician during a delivery, we can set parameters that we need the end user to go in. I'm going to bring this all down before I show you how this works. And so the way it works is you start off with tilt always going first. And that allows somebody to stay in position. If you start off with recline, it's going to slide their pelvis forward and get them out of their position. And so tilt first, and then it goes to the legs, and then recline. And so we can set this up through different drive controls. If somebody drives with a head array system or a sip and puff, we can have it work through all of those. And I slightly have the actuators. Those are the motors that move the seating system. They're latched, slightly latched. I have to tap it a couple of times. And what that means is you only have to give one command to put the chair into motion. And these are just the parameters that I set for today. So the chair is going to tilt first. And so you can get that client into the 20, 30 degrees of tilt that they need. So I've got to tap it a couple times. You can set it where it will do it in one motion as well. And it's going to elevate the legs second, and this just helps maintain position in the chair. I don't know how far up they're going to go. And then it will go to recline last. And so this helps somebody be independent in their chair, as well as hit the proper angles that you need them to be sitting at to get the pressure off their bottom and to help with their health care. One thing that Permobil actually just partnered with the University of Pittsburgh on, I haven't been allowed to talk about it until yesterday, and so I can finally talk about it. It's still new to me, so I don't know as much about it. But with them, we've come up with an adapter that goes on the chairs. And there's an application that your chair will sync to your smartphone with, whether it's Android or Apple. And after the clinician sets the parameters of the chair where you want them to tilt, it will set a reminder off throughout the day for the patient. They'll get a reminder on their phone to perform their pressure reliefs. And then they'll be able to see the angles that they're going back. And so they'll know when they're at the optimal position for their pressure relief. And so that it will give feedback as well to the therapist, so they know that what you're doing, and so we can look at different avenues of healthcare for wound management or whatever it may be. And so this is going to be coming out in probably the next 2 or 3 months is what I'm told. And so I'm pretty excited about it. I know for the wound care side of things, it's going to be huge to be able to have that reminder to tell you to go back and do your relief, but to be able to see it as well. And there will be a USB port on there so you can plug your phone into it and keep your phone battery charged while performing those reliefs. So that's just going to help a lot with the clinicians to know what the client is doing. It might help with insurance funding, and it's going to help the patient to know where they need to be in the chair to be able to relieve those pressures. So we should have that coming out here in the next couple of months. So anyhow, those are the independent positioning features on the chair. Really nice for those who don't always have the cognitive ability on what they need to do to go through the seating functions of a chair. It makes it much easier. So we'll pull out the standing wheelchair now. Get that out of the way. So we have a power stander and a manual standing wheelchair that I brought today. So I know the first question that we always get asked is, how do you get funding for these? And it's something we're working really hard with Medicare and Medicaid on. Right now, Medicaid legally cannot deny somebody that does have medical justification as not medically necessary. We might see it happen and it might be a fight, but if somebody needs to be in one of these chairs, it's worth the fight to get them to pay for it. So there's 3 different ways that we can do the standing with this. You can do a tight stand, which means you're going to stay in your seated position and stand straight up. There's an open stand, which opens up the back angle just a little bit to stand you up. And then you can do a lattice stand, where the chair will recline the backrest down and elevate the legs and then stand you up all in one motion. And so this chair currently, we have this is the C500, and this is considered a Group 4 base, and so it's a little bit more heavy-duty of a base. Really good suspension for outside use. The base is 27 inches wide, so it's a little bit wider than a traditional 24-inch wide power chair. But it comes with a technology in the motors that's it's called ESP, and what that is, it helps you track straight. So a good example of that would be if one wheel's driving on concrete and one wheel is in the grass and you hit a little hole in the grass, most chairs will spin you around as you do that. With this, it will apply more power to one motor to keep the chair tracking straight. And that's a feature you can actually get on all of our chairs. It's kind of a similar technology as the Segways have to keep the chair upright, or the machine upright. But anyhow, the standing power chairs, funding sources for these, private insurance companies have actually been seeing pay for them recently. Some you have to really fight them, and seen some go through very, very easily, as long as the justification's there. The last one I saw with a private insurance, the lady was a paraplegic, and it was actually used to kind of help stretch her out, and so they paid for it for that. It allows somebody to be eye level, which is huge, to be able to see their peers eye to eye. So we'll go through a couple of these justifications that insurance companies are going to look for. So the benefits to this, it's going to help you improve your functional reach, ADLs. So if you need to reach into cupboards, it will allow you to do that. It enhances your independence and productivity. And that's something that Voc Rehabs will help pay for. If somebody has Medicare as their insurance, Medicare will not pay for the standing feature. They will pay for the power tilt and recline and elevating legs if somebody qualifies. And so if it's going to help somebody in the work setting, Voc Rehab can come in and help pay for the remaining portion of the standing. It is expensive, but we're seeing coverage come to those. We're also seeing fundraisers performed to help people that can't get these paid for. And it can take a little bit longer doing a fundraiser, but we're seeing funding. I personally have not heard of anybody that needed a standing chair that fought for a standing chair not get the standing chair. There's always been a way that they end up getting it. And so I just think if we fight these more and more with insurance companies and prove how much more beneficial this can be to the right client, that things will get better with time. It actually helps a lot with your bowel and bladder, being able to stand up and allow things to go more regularly. There's studies shown that where it completely increases your bowel movements. People that are using enemas regularly, where it helps them become regular. It allows you to reduce urinary tract infections by just being able to fully drain. It's really good for bone mineral density. A lot of times people, cerebral palsy, or people that have cerebral palsy or spinal cord injuries, they're prescribed a standing frame as well as their wheelchair or their power wheelchair. They'll use it for a little while, and it ends up becoming a clothing rack is typically what it is. People just don't have the ability to transfer back and forth between their wheelchair to their standing frame. And so being in this, it helps with the bone mineral density in the legs. It helps reduce the occurrence of pressure sores. With pressure mapping, we found that being able to stand is more effective than doing a tilt and recline in a power wheelchair, because you stand up and all the pressure comes off your bottom. So that is a huge justification for it. It helps increase or improve your passive range of motion and muscle tone by being able to stretch out regularly. I talked about it earlier, how we weren't meant to sit in one position all day, and this allows you to stretch out and reduce that risk. Oh, that might be it with that. So I did want to show a little bit with this chair. Right now we have it programmed to do, I think this is the tight stand, tight sit to stand. The nice part about this is somebody can safely drive the chair while they're in the standing position. It's really fun to see a user get into this and stand up for the first time and be able to do things they weren't able to do before. And so a lot of the common diagnoses that we see for these right now are spinal cord injuries, and then cerebral palsy is another big one we've been seeing a lot of. Got a couple kids actually that we're starting the process with these right now. You can put alternative drive controls on here. You can do a head array system, which we're going to talk about in just a minute. That's actually the next thing we'll talk about. It's very important to get a good measurement with these chairs. If you have a backrest that's a little bit too tall for somebody, the headrest is going to move and they're not going to be able to control the chair if they're using the head array system. But the nice part about this is they can stand up and drive the chair and still have good maneuverability. They can navigate through a home. So if somebody's in the kitchen or cooking food, it allows them to be up above a pot of boiling water and to be able to see in and make food without injuring themselves and be able to just see what's cooking. So that's the power stander. I did bring a manual standing wheelchair as well. Bring this over. So when measuring somebody for this type of equipment, things change a little bit, where with a traditional measurement, we usually leave about an inch between the back of their leg and the seat. And with these chairs, I usually say do about a ½ inch. You want that seat depth to be about as long as you can. And so I have to demonstrate how this chair works. It comes with the knee block. We have different contours of these pads where it can be more contour. This is the least amount that you can get, so you can't have less. So you have these little rods that come out. And the knee block goes on. Little safety lock. So how it works, oh, I locked it. Better unlock that. These two levers on the side allow you to push yourself up. So you have to have the arm strength to somewhat push those up. We do have a power option with this chair where it can elevate you that way. But most people go with the manual option on this. We actually have a video on our website, or on YouTube. It's our video, though, of a girl here in Utah, and she is a C5 complete spinal cord injury, and so they've adapted the chair so she could hook her hands and push herself up. So it allows her to get to the standing position. You can put supportive backrests on, and you have a chest strap that you can wrap around to give additional support. But a chair like this allows you to be functional in the home environment or work, and it allows you to perform pressure reliefs, which is huge, among all the other clinical benefits. And to sit the chair down, it kind of puts you into a floating position if you don't pull yourself all the way down. And so it allows you to push yourself around if you need to hurry and get back into a standing position. So otherwise, you have to make sure you lock the handles down. So that's it's called the Helium. The chair, it's made out of aluminum and titanium to try and keep it light. Because of the standing feature, it still weighs about 35 pounds, which is a little bit heavier than your traditional ultralight wheelchairs. But the chair pushes very light for its weight, if that makes sense. It's got an adjustable axle, so you can bring those wheels into a position that makes it easier on your shoulders to push. And you can actually put the power assist wheels on here, the e-motion wheels. And so if somebody has very limited strength, those wheels allow you to just touch the handrim basically, and the chair will drive for you. And so that is an option that you can do on this chair. But we are starting to see a lot more funding for this. This is a little bit less expensive than the power chair. This is about a $10,000 chair. The insurance will help pay for the wheelchair portion, but the standing portion can sometimes be out of pocket depending on your coverage. Again, workers' comp for both of these items is a great payer source. Voc rehab, private insurances. Medicaid, it's worth fighting them on it. Just because the clinical benefits are there if the right user needs one of these type of chairs. So now we'll go a little bit into electronics. The first one we're going to talk about, I didn't hook these up just because I didn't want too much stuff on a chair at once. This is actually Permobil's head array system. So the nice part about this is it is probably the most sensitive head array system I've seen, where some of the other ones you have to sit and smack your head into the proximity switches to get them to work. With this, it is so sensitive to the touch. You have a left pad, a right pad, and you can actually put a fourth pad on here if you need for different modes. On this head pad here, on each side there's a proximity switch, and so what that means is you just have to get close enough to it to activate the chair to drive forward or backwards. And then you can tap these the side pads to turn the chair. We've actually got I don't even think the kid is 4 yet. He's in Ogden. He has cerebral palsy, and they've been working with him in the school, and he's actually now getting a chair with this on it. He's waiting for insurance funding right now. So it is a neat system. Just allows people that, if they've hurt their neck or don't have hand control but still have head control, the opportunity to be independent in their chair, to be able to drive themselves around. I think this is probably one of the easiest systems to set up. Our chairs kind of learn technology when you plug things in. When you plug it in, it basically programs itself and turns on. The nice part is these pads, they've got it tightened in. I just picked this up. They swing out of the way if somebody needs the pads to swing out of the way. You have a power button on the back of the headrest. So if you're making adjustments, you can just click that off so somebody doesn't bump the headrest and drive the chair. And underneath, probably can't see very well, but there's multiple places that you can plug switches in. You have jacks for that. And so you can have a mode button for turning the power of the chair on. You can have one for getting you into your seating functions or whatever you need. So that's the head array system. I'm actually going to bring out the sip and puff right now. If people aren't too familiar with sip and puff, it goes on air pressure. So you plug this into actually, where's my display? Into the display of the chair, and that's how both of these work. And you calibrate the forward, reverse, and the turning commands by having somebody blow into this straw. I've got it covered in plastic just because I don't want to ruin it for somebody that will need it down the road. But it's typically smart to evaluate somebody for a sip and puff at the end of the day when they've fatigued, because you want the calibrations to be at their weakest time. You don't need to blow too hard into these. You can just have a small puff to command the chair to do what you want. But the neat thing that we're doing now is we have a system that's a head array sip and puff combo, where you use the sip and puff for your forward and backward commands, And then you have those pads from the head array system that you can tap to turn the chair. And it just makes it a lot easier for people. The sip and puff is nice because you can do what's called latching, or not latching, but stepping the speeds of the chair, where they'll give a puff to go forward and they give another puff and it will keep speeding the chair up to a certain point that's programmed. And so that's why I like the sip and puff, because you can control your speeds a lot easier than the head array. So that's a really neat combo that we're doing now. Different controls that we have. We're doing a lot of these with our ALS clients. If I can find my, there we go, Haines Harness. This is something that Permobil actually owns as well. A lot of times when somebody is diagnosed with ALS, they start off having hand function that might be weak or limited. So we'll hook up, instead of a traditional joystick like this, we'll hook up a compact joystick and we'll have the display on the other side. And as their disease progresses, we can take this joystick and mount it in different places for access. One of the ones that I'm a big fan of is the Haines Harness, where you can mount this joystick as a chin control, and they can use their chin to drive the chair. Just allows you to have a proportional joystick is what it's called, which means you can drive in any direction, and the harder you push it, the faster you go, kind of like a gas pedal on a car. And so this is a really good setup that we're doing for a lot of the clients coming out of the ALS clinic. But this joystick can be mounted pretty much anywhere on the chair. If I can find where I threw all my stuff. Oh. So something else that Permobil makes, it's called Permobil Fix. It's a little hardware kit, and it comes with a whole bunch of links that are adjustable. You can add different arms in or a swing away mount on here. But what this allows is to put a drive control or switches to access your drive controls anywhere on a chair. We can mount this to the footrest or anywhere that the chair has a rail. I'll bring this chair back over. So underneath our armrest, we have these track rails. And so you can mount this on the armrest. You can mount it on the, so if you need somebody to have a drive control more midline, you can do that. I'm helping someone work on a chair right now where the joystick actually has to be upside down for the girl to be able to control the chair with the joystick. And so you can use them to mount a joystick basically any way you want. It mounts in the side rails on the seat. So if somebody wants to use, say they're using a head array system, but they don't want to use the pads on the side of their head to turn, if they still have leg function, we can mount those pads down here, and they could tap the pads to turn left and right. And so if somebody has some sort of movement in the cognitive ability, the important thing is we can make somebody become independent, to be able to drive a chair and get out on their own. Yeah, you can mount this on the back of the headrest, or on the back of the chair as well. So Permobil Fix is something that we've been doing a lot of lately, actually, to mount drive controls and switches. The last drive control that I brought is just the mini joystick. And what's nice about this is something that we see a lot with either ALS or muscular dystrophy. Just a small joystick requires basically no force to be able to activate it. It's still a proportional control, which gives you the ability to drive in every direction and in various speeds, but it basically requires no throw of the joystick. And this is actually another common one that we put on the Haines harness for ALS. If they're too weak to control the head, they just barely have to wiggle the chin or lip or whatever part of the body we need to mount it next to control. But the important thing to remember is whatever the diagnosis, if somebody has the cognitive ability to understand to stop before they hit somebody, we can get them driving a chair. I know with one of the school districts, when I was there, they had a girl driving through, and she was driving perfectly through the hallway at this school. But before she got that chair, nobody thought she'd be able to drive it. It took them 2 years with doing demos with her before she could drive a chair, but it helped her mind develop, and become a different person. And she's now independent in a power wheelchair and completely safe. And so sometimes it might take a little bit of time to get somebody driving, but it's worth it in the end to give somebody their independence. I guess at this time, so yeah, if there's any questions, we've got just a couple of minutes left.
I'll keep watching for questions here as I finish up here, but we really appreciate Travis coming to present this to us today. A lot of great information. I just want to remind you as we finish up to take the evaluation. Again, that link is located at the bottom of the AggieCast page titled UATP Survey. And I always appreciate ideas for future trainings here. This particular training will be archived after it's closed caption, and DVDs will be available, and it'll also be available on YouTube. And as soon as that's available, I will send an email out and let you know. It'll probably be a couple of weeks. And you can also check out all of our other archive trainings on our blog. That's utahatprogram.blogspot.com. You can also access those from our website. And I just wanted to mention also a note about our foundation, the Utah Assistive Technology Foundation. We do have loans under that program for people to be able to purchase assistive technology devices like the wheelchairs we saw here today. And you can learn more about those loans online at www.uatf.org. And just a note about upcoming trainings. We don't have a date set yet, but we will be getting a training from the Utah Disability Law Center about how to pursue cases of assistive technology being denied through insurance, school districts, etc. And we'll let you know when we have set a date so you can register for that. And again, thank you for attending, and it looks like we don't have any questions here, so we'll wrap up and see you